Hello everyone, my name is Dr. Marty Kotler. I'm the president of Target Coding. Thank you for listening to this presentation. We have a treat here for you. We're going to be going over financial policies, time of service, fees, and how to prevent dual fee schedules, and a bunch of other things as it relates to the financial aspect of your practice. So let's get started. Before we get started, let me tell you a little bit about myself. For those of you listening to this, if you're a member of Target Coding, you should know who I am. For those of you that do not, again, my name is Marty Kotler. I'm a chiropractor. I'm certified in CPT coding, certified professional compliance officer. I write articles for chiropractic economics and dynamic chiropractic. I'm a member of the ACA and American Academy of Professional Coders. I speak for many organizations like the Coding Institute, Parker Seminars, Foot Levelers, and I'm a guest speaker at many national and state chiropractic association conventions nationwide. Today we have an amazing guest speaker joining us today. His name is Dr. Ray Foxworth. He is the president of Chiro Health USA. He is a medical compliance specialist. He currently sees patients. He's in practice in a multi-specialty practice. It's called Campus Spine Center. He's a contributing author to the American Chiropractor and to numerous state association journals. He's a member of the ACA. He's a guest speaker at many national and state chiropractic association conventions, and he manages Chiro Health USA. In my opinion, the number one, without a doubt, DMPO, Discount Medical Plan Organization. It's a network of over 2,500 offices, and that serves over 160,000 patients. So there's a lot of experience here between me and Dr. Foxworth, and we want to share a whole bunch of things with you. So now I'm going to switch the microphone over to Dr. Foxworth. Please join us.
Thank you, Dr. Kotler. I certainly appreciate the opportunity to speak to your members and to your guests. And would ask that you put on your list of things that you do is you're one of our consultants, and we certainly always appreciate being able to contact you for advice and refer a number of our clients to you when they have things that are far outside our area of expertise. Doctors, today, I guess what we want to cover with you is kind of what we found to be the 5 most dangerous things that we face on a daily basis in our own practice. And it does have to do with our billing, our coding, our documentation, and then probably over the last 5 to 7 years, I guess what has really kind of come into an area of concern for us is discounting. We know most doctors do offer discounts to their patients. The bottom line is if you're in a PPO or a HMO plan or any health insurance plan, you're already offering discounts. It's nothing new. We don't want to encourage you to lower your fees, but the reality is doctors are offering discounts, but too many times we find that our doctors are doing it the wrong way, and I'll explain that to you in a couple of minutes. And then there's also the issue of our collection policies. How and when do you collect the money? We have seen numerous third-party payers, Blue Cross plans, issue bulletins to providers recently about not collecting in advance for services, and in many states that's actually considered the business of insurance. So we've just got to be really mindful that there are layers of rules and regulations that we have to comply with. It is a healthcare system out there, and part of that system are those layers of regulations that we'll get into in a couple of minutes. But the big things that, all of these issues really fall under a couple of topics. Dual fee schedules. I know a lot of people have heard that term, but for people that don't know what that is, it simply means I'm charging, let's say, $100 to PI and $50 to cash. That's a dual fee schedule. And in a number of states, that's patently illegal. In other states, the boards haven't addressed that. There's improper time of service discounts. And what I mean by that is, a time of service discount should be in probably the 5 to 15, maybe 20% range. The OIG said a couple of years ago that that was a reasonable range for a particular hospital to offer a discount. But we see doctors offering 40, 50, 60% discounts. And at some point, you got to understand that that's not really a reasonable discount. That's not truly reflective of your bookkeeping cost, unless your bookkeeper happens to be your wife, perhaps, as has been in my practice. And then we've got inducement violations. That's the patients that you see, and they've been such a great patient, and you give them, you might give them gifts or send them to the movies. Well, there's some OIG regulations that talk about giving away anything more than $10 or a total of $50 in a year they consider that inducement. You know, you consider it being a nice guy, the federal government considers that you bribing that patient. And then we have False Claims Act, and this is really a big one that we have to be careful of because these violations carry some pretty hefty fines. You know, a False Claim Act is something as simple as me sending in a claim for $100 for services. The patient has a $20 copay, but I happen to waive copays, or I don't collect them on every single patient. And while it's okay to waive an occasional copayment or discount under some hardship agreement, routinely not collecting those, you're actually submitting false information to the insurance company. And they have absolutely taken doctors to task. Kennedy versus Cigna is one case that comes to mind where they said if the patient doesn't know anything, we have no contract to pay on their behalf. They ended up in court. Bottom line is you've just got to make sure that you're not submitting false claims and false amounts. And then, of course, there's the anti-kickback statutes. Certainly you know that you shouldn't be bribing patients to refer other patients in or to have what's called runners. You've really got to be careful about that. You know, if every time a patient sends somebody in, you don't collect a deductible or a copayment, or you give some gift to them, just be very careful of that. Dual fee schedules, we've talked about that. Those are certainly a problem dealing with your cash patients, but you need to also understand that it may also violate some state regulations and even your provider agreements. We have seen some provider agreements out there where they have what's called most favored nation status, meaning you're supposed to give that insurance company the lowest rate you charge anyone else. Doctors, you got to start reading your provider agreements. I know we don't like to do that, but you need to get in the habit of doing that on a regular basis because you are responsible for knowing what's in those agreements. And then, you know, I've already talked about the improper time of service discounts. And again, the inducements, bottom line is you give things away to patients for free that trigger them to come into your office. You may think it's practice building. Federal government, other regulators think it's an inducement, and there are fines up to $10,000. Here's what I want you to take away from this. We want you to help your patients. That is doing the right thing. And everybody doesn't have 100% coverage for chiropractic. That's the reality. What we want to let you know is doing that the wrong way is what can cost you. And what we hope to share with you today is what some of those issues are that you need to avoid and how you can solve them using this model that we found called the Discount Medical Plan Organization. Marty, you feel advanced for us?
Oh, wait. We're not going, wait, slow down, Dr. Varg. Wow. That was a lot of information that you just gave out, so I have questions.
That's an overview.
Whoa. This one slide, you could probably do a whole weekend seminar just on this one slide, so let's back up a little.
Sure.
This is what I hear every once in a while from a client. They'll say, Marty, you know what? The teachers, I take care of a lot of teachers and firefighters. I want to waive the copay. I'm in network. It's a $20 copay. I love teachers. I love firefighters. I want to waive the copay on all of those patients. Is that okay?
Are you asking me?
I'm asking you. I'm asking you. I hope your answer is going to be the same as what I give my clients, but, you know, I'd like to get your take on that.
Sure, and I'll tell you, this has always been interesting. You know, you get 3 consultants in a room and you get 4 answers to a question. So hopefully that doesn't happen. I will tell you emphatically, I don't think you should do that.
Right.
And here's why.
I agree.
Your doctor may be a nice guy and he may love teachers, but the reality is there is a contract in place, and that contract holds that doctor responsible for collecting the deductible and the copayment. It also, as part of the cost-sharing provisions, part of the contract is the patient must pay their portion. And if you don't, you are in violation of that provider agreement. Pure and simple. I'll give you one exception to this that I have encountered in 28 years of practice. I had a local union, a trucking union, that said, we'll send you all of our patients. They have 90% coverage for chiropractic. We don't want you to collect the 10%. And I said, no way. I'd love to see those patients, but I have an agreement with this insurance company. And they said, wait a minute, we're self-funded. They're just the administrator. And I said, then you give me a letter from the union and from that processor, from the Cigna, as a matter of fact, is who it was, that I don't have to collect it, and that's the only circumstance that I'll consider waiving that 10%. Bottom line is, they provided it, I had it in writing, and we were okay with it, but only in that circumstance.
Right. Yeah, I've heard other circumstances whereby if it's an out-of-network provider where he's saying, well, I'm not going to collect the 20. Let's say it's an 80-20 plan,
Right.
not a copay. It's a coinsurance, 20% coinsurance. I'm going to waive the 20% coinsurance on all the teachers and firefighters. This is what I've heard. Let me get your take on it. Well, can you do that? Well, maybe, maybe not. Okay, so how could it be possible to do that? Well, if I'm going to waive the 20%, discount the 20% to the patient, then I should offer that same 20% discount to the carrier. So instead of billing them $100 a visit, I should only bill them $80 and only collect the $64. What are your thoughts about that?
I think if you're passing the discount along to the payer, you probably have a better leg to stand on. What I would be concerned about is if they're going to lower that fee to the patient, what I would caution them against is waiving the patient's portion. Because I think as long as you're charging the patient something and it's in proportion to their percent they should pay by their agreement, I think you're okay. Make sure that you're collecting that copay and not just waiving the copay.
Yes. And then, you mentioned a little bit about a prepay. I discourage my clients from having patients, especially in network, prepay their copays. I don't think, I don't think that's okay. I've never read any provider agreement that allows a provider to have the patient prepay their copays. Definitely not discounting it, but first of all, I wouldn't understand why a patient would prepay their copays. If you're telling me to come in for 10 visits and it's a $20 copay, why should I give you $200 in advance? I'll just give you $20 every time I come in. I'd rather have the money in my pocket than give it to you. But I understand that, some patients might be willing to prepay their copay, so it just makes it easier for them. There's less, paperwork involved and stopping at the front desk. Any thoughts on that?
Yeah, absolutely. The reason chiropractors particularly like prepays is we think patients have skin in the game and they're less likely to miss their appointments. And that's probably true. But the issue is when there's a third party involved, the insurance company, you're clearly in violation of that agreement. It is a copayment to be collected at the time of service. I have seen some contracts that do permit payment in advance for certain services, but those are usually limited to ambulatory surgery centers where they might reserve a surgical suite or reserve, a particular procedure, piece of equipment or something like that. Routinely asking your patients, or I would say I never encourage patients to prepay on their copayments. And, if we can kind of take a little side trip here, I think you'll enjoy hearing this, Marty. I sat through 13 hours about 4 weeks ago, a 13-hour board meeting in our board of examiners. Great doctor was there, nice little patient, but they were there, and at the end of 13 hours, guess what it came down to? A complaint was filed over the doctor's collection policies, prepays, and the patient felt like she wanted a refund towards the end. And, in my opinion, the quickest way to ever solve that problem, the first question you ask is, how do you spell your last name? That whole 13-hour hearing, hiring the attorneys, the trauma that they all went through, this partner's trauma, I think, in my opinion, could have been alleviated if they'd just not gotten into the habit of doing that prepay and then not honestly dealing with a patient and addressing their concerns right up front if they did ask for a refund. I just think it opens up a can of worms that we don't need in this profession, and all of that could be solved if you turn the table a little bit and instead of doing a prepay, get a credit card on file or a bank account on file and let the patient be auto-debited or something like that. Then you're always collecting on an account rather than having been paid in advance for services that you can't promise you can deliver. I think that's the big issue.
Yes, I totally agree with that, and I am involved right now. One of my clients is being investigated by the state board because the doctor did a prepay, and then the patient originally committed to 20 visits or 30 visits. After 5 visits, the patient said, I'm not happy. I want out." And then the doctor does that retroactive, charging the full retail
Sure.
fee. Oh boy, that
Yep.
really upset the patient, and that's what ignited the board complaint.
Yeah, I think our colleagues really need to hear those two stories and understand something.
Right.
The most common thing that will get you into a problem in your practice is not malpractice. We do a good job in taking care of patients. The most common complaints filed to boards of examiners are not over your treatment or over malpractice. It's over dollars and cents. And I just wrote in a little article recently, our pastor happened to say from the podium one day, "You can be right or you can be happy, but you can't always be both. So choose wisely." And when you have patients that are upset over dollars and cents, you can be right or you can be happy, and you should think about choosing wisely. If money will fix it, it's not a problem. And if you can make a problem go away with a refund, trust me, doctors, it's worth it. And I don't want to send the message that we shouldn't be paid for what we do or be an easy mark for patients. But for goodness sake, understand there are people out there who have nothing better to do and want nothing more to do than to take you to task and file a complaint, and you get to go hire the attorneys and defend yourself. And you might be right, but you may not be happy in the end.
I agree. All right, we're going to go to the next slide.
Yeah, this one is one of my favorite ones. I've been in practice since 85, almost 29 years now. And, in chiropractic, we're all kind of renegades. I guess you just kind of have to be. And my attitude used to be it's my practice. Who cares what I charge? It's none of their business. They don't pay my bills. They don't hire my staff. It's my business what I charge. Well, the reality is that may be true if you are a 100% cash practice. You never see an insured patient. You never see a Medicare patient. You don't have anything to do with that world. But that's not reality for most of us these days. And I will tell you, the moment that you step a foot over into that other world, the insured world, third-party pay, there are rules and regulations you have to find. And let me be real clear about this. I don't want doctors hearing this and say, "I'm going all cash." I do not recommend that personally, because we still have a number of companies that pay us and pay us quite well. I just want you to learn the rules. That way you don't have to pick all cash or all insurance. You get the benefit of both. So what we have to understand is there are rules and regulations. Our profession, unfortunately, in some OIG audits, we've had a pretty high error rate, 67% reported in 2005. 2008, it wasn't much better. The OIG is actually, I think it was on camera and on video, they said for every dollar they put into investigating healthcare fraud, they get $17 back. We have RAC audits and probe audits, and I don't know who comes up with the names of those, but none of them sound pleasant. 2012, we were in the OIG work plan. I need to update my slides. It's 2014. Guess who's in the OIG's work plan again? We made the list. And for those of you that think that the federal government is broke, they are. But for some reason, they found in 2013, they found $350 million to add into healthcare fraud investigation. And it's real simple, docs. You put $1 in a slot machine and you get $7.90 out. That's a pretty good deal. That's a 790% return on investment. So it's not that maybe healthcare insurance companies, the regulators hate doctors and hate chiropractors. It's a money issue. They're reaping a lot of money from doing fraud and audit investigations. And when if you're an insurance company, think of this. Can't raise premiums any higher, can't raise deductibles any higher, can't raise co-payments any higher. We've already got managed care in place. Let's go look at some of the money we've already paid the doctors and see if we can't get some of that back. Plug a buck in, you get $7.90 out. All of a sudden, you have a fraud investigation unit. So just be aware that, you might be autonomous, you might own your own practice, but because you participate in this healthcare system, you've got to know what the rules are, and just understand that we are under scrutiny, and the reason for telling you that isn't to scare you, but you just need to be aware of the rules and regulations, and there's some signs out there that tell you what you should and shouldn't do. What's the speed limit? You just kind of need to be aware of those things.
Yeah, compliance is very important. The healthcare industry. Maybe the food industry has more compliance on it than healthcare, but it's got to be close. I mean, the healthcare industry is under super compliance because of all the fraud that occurs. So, sure, this could be scary, especially to a new doctor. Oh boy, I'm gonna get audited. I'm gonna have to give money back. No, that's not the approach to take. The approach to take is be a sponge, learn as much as possible, and protect yourself. That's what you should do. Get a coat of armor around you when you're in practice, so nobody can come in and start snooping around and put you, and find exposure. So that's why there's companies like Chiro Health USA, companies like mine, Target Coding, companies like Kathy Chang. We're here to help. That's what I call it, Ray. I look at my clients, they're like my children. Although many of them are older than me, I look at them as my children. I want to protect them. And that's how you prevent all these scary things from happening. But, I also tell my clients, listen, you want to go all cash? Great. I don't think it's easy, but of course it is easier to manage a cash practice, but doctors have to understand that there's a difference between a cash practice and a cash patient. A cash practice, if you don't want to worry about all these audits and OIGs, then the only answer is to only accept patients that do not have insurance. But that's not the case. Out of every 10 patients that walk into a chiropractic practice, at least 7 out of 10 have some sort of insurance that covers chiropractic. So you could be a cash practice, but you still have to give the patient a super bill, a 1500 form, a receipt. Sure. You have to put a diagnosis code on it. You have to put a CPT code on it. Your documentation has to support the code you're billing. So even if you're a cash practice, you still have to follow some rules.
That is so important, Marty. I hear a lot of docs say, "Oh, I'm going to a cash practice and I don't have to worry about all this." And so, honestly, doctor, nothing could be further from the truth. Your documentation standards haven't changed. Your responsibility as to make a diagnosis, provide your patient with a receipt with the things you mentioned, ICD-9, CPT, coding, all has to be accurate. Really all you've done is lowered your income. If you would spend as much effort figuring out how to do this right as you are figuring out how to just go cash, your bottom line is absolutely going to improve. And let me tell you why I feel that way. Compliance will make you more profitable. And most of the docs don't ever hear that. The more compliant you are, you're going to find that you're not billing for things that you should be. You're forgetting to bill for things when you're in the room with the patient and you're busy and you're backed up. Something as simple as looking at your end-of-day printout of everything that was done that day, it happens all the time. You see a patient, you might have done an exam, but you forgot to mark it. You sent a patient for x-ray, you forgot to mark it. That happens every day. But if you're not looking at that on a daily basis, you don't know that you're not missing. You don't know that you're missing that. Conversely, if you are looking at your daily printout and you see, geez, I only adjusted 1 to 2 areas today. I'm usually adjusting 3 to 4 in that patient. I send my front desk staff an email, not a phone call, because I want a paper trail. She prints that out and it goes in the patient's file. We adjust the charge. I get audited and they're going to see, yep, Ray made a mistake. But he notified the front desk staff that he made the error. They corrected it. And doctors, that's called a mitigating factor. I have a compliance manual. We put a copy of that little email I sent to the staff, and at least it shows I'm trying to do a good job. I'm at least looking at what I'm doing on a day-to-day basis and just trying to make sure that I'm not making errors. And that's really what they're looking for. I mean, certainly they're looking for people that rip off the system, but more importantly, they're looking for doctors to start self-auditing, self-reviewing, just to try to cut down on some of the unintentional fraud and abuse that's occurring to the healthcare system.
Right. Compliance makes you accountable, and, that's okay. And the reality is, Dr. Foxworth, providers don't have a choice. You don't have a choice. You have to be
That's
compliant.
true.
You have to do it. I mean, if you're not, if you're going to bury your head in the sand and not pay attention to this, then you're going to get caught and you're going to have problems. So, all right, we're going to go to the next slide.
You know, I think we've already kind of touched on some of this in our
Okay.
previous talk. And again, I don't want to put doctors in the fear factor, but I want you to be informed. And the good news is there are some real simple steps that you can take to minimize your risk. And one of my favorite sayings is, you know, you can listen to this webinar, you can buy all of Marty's materials or anybody's materials and put it on your shelf and think, boy, I'm compliant. Wrong. It is not an event. It's a process, and it's an ongoing process. And I'll offer to you that it is in chiropractic specifically, it is our financial policies that put us at the major area of risk. It's the easiest thing for auditors and investigators to target. And let me tell you how easy it can happen. We have a doctor who posted a notice to us on Facebook that she got a call from a patient, and when the patient was asking how much is pick a service, massage, and they said, well, $50. And the patient says, well, I don't have insurance. Well, it's $40. And the response was something to the effect, that's really good to know. By the way, I'm the adjuster on this so-and-so's case. I'm a Geico adjuster, and I'm reducing your bill. You have a dual fee schedule. That's from a phone call. They just talked to the front desk staff. You don't think that that's easy? When patients come into your office, you know, one of them may be a personal injury case, and you're billing out $100 a visit. Your other patient may be a cash patient. You're charging $50 a visit. You don't think they talk to each other, or they may know each other from work, and you don't think people compare notes? And even though it may be completely legal to charge PI that fee and cash a lower fee, if you don't have the policies in place that make it okay and you don't discuss what your fees are with your patients, that's what creates the suspicion. And that's what creates doubt in patients' mind, and that's what can ultimately make them pick up the phone to call, you know, 1-800-BUST-A-DOCTOR or call your State Board of Examiners. We just want you to have your financial policy squeaky clean, and it is not that difficult to do if you have the right tools in place, like a good hardship policy. Make sure you're documenting and coding properly. Make sure you got a good financial policy, and I will tell you, as you'll find out, plugging in the model of a discount medical plan, whether you use ours or another, I tell docs, do something. Doing nothing simply isn't an option. You just got to clean this area of your practice up.
Correct. Most providers, when they hear and staff members, when they hear financial policies, they're just thinking, okay, this is about billing insurance and you know, and balance billing patients or collecting, you know, over the counter co-pays and cash services. No, it's not only about that. Financial policies can spill over, as Dr. Foxworth just mentioned, to state board issues and even malpractice situations can occur because a patient's upset. I'm working with one doc right now, decompression treatment. He had the patient prepay for 20 decompression treatments. After about the 16th decompression treatment, the patient said, you know what, I'm not really feeling that great. I don't feel like I'm getting the results that I expected. I want my money back. The doctor says, I'm not giving you your money back. I didn't guarantee the result. The patient said, if you don't give me my money back, I'm going to report you to the board. And you know what? I think the last couple of visits, I feel worse. I might sue you for malpractice. So the doc said, I'm not giving you your money back. What do you think the patient did? The patient filed the complaint against the doctor, has not gone to the malpractice level, but has filed the complaint with the state board on the doc. The doctor's notes were terrible, horrible, and now the state board is breathing heavily down this doctor's neck. They are threatening some major disciplinary actions against him, and it has nothing to do with the patient's complaint. It's about his documentation. So getting paid is important. Billing insurance companies is important, but it's not only about getting paid by insurance. It's about malpractice prevention and preventing state board issues from occurring. So, yeah. Dr. Foxworth, are you going to mention that, or share with us how can a doctor's financial policy have some verbiage in it that states we don't guarantee results, and we don't have to give you your money back if you're not feeling better.
That's not something that we really address. I think every doctor should have some type of, not disclaimer, but the consent to treat. I think that's becoming a big thing these days, and I think as part of that, you absolutely should include some type of language about that it is not a guarantee for treatment or a guarantee of cure. You have all signed those kind of documents if you've ever gone in for any procedure with any doctor. Chiropractors just been a little slow to catch on to that. I think what we try to do from our perspective, since we know it is the financial policy that puts the doctors at risk, we actually have a little simple one-page, hard to believe it took me 28 years to get my overall financial policy to one-page, single-sided, but we did it, and it simply says, in an effort to comply with the various rules and regulations, as well as managed care, billing, coding, documentation guidelines, we've established a single fee that applies to all patients. You may be entitled to a discount if I'm in your health plan, if you're Medicare or Medicaid with a mandated fee schedule, or maybe PI workers' comp, if you are entitled to a hardship discount under our hardship policy, or if you're part of a discount medical plan like Chiro Health USA. And then we have some verbiage to that. If the folks on this call want a copy of that, they could send an email to info@Chiro Health USA and just put form in the subject line, and we'll send that out. And again, that's more to address your financial policy, not so much the clinical side of it. And Marty, I would defer to you if you've got some language that you would recommend for that.
Well, after that incident, I was going to start recommending that all my clients put some language in their financial policy about not guaranteeing results. So I'm working on that. But that's a very generous offer that you're offering everyone. So everyone, again, if you're interested in receiving Dr. Foxworth's financial policy, just send an email to info@Chiro Health USA. Again, info@Chiro Health USA. Put .com, remember, info@ChiroHealthUSA.com. And in the subject matter, put form, and he'll get it out to you. So thank you for offering that. Let's go to the next slide.
A popular little item. All right, this one is, I used to call this the pole of perspective, and then the totem pole, and then the kaleidoscope, and I'm not sure what my favorite moniker for it is now. But what we want to get across to you is that we as chiropractors, and I'm going back 30 years, keep in mind, I don't know how long the docs on this call have been in practice, but there was a day and time when all I had to worry about was my board of examiners. And the reality is, over time, even the federal government has said that there's been extensive layers of rules and regulations that have developed over time that affect different healthcare providers in different ways. And that statement was actually made in 2004. And what that statement tells me is exactly what I've experienced in my life. In 1985, all I had to worry about was passing my State Board of Examiners exam, and then listening to them about what can I do with my advertising, what can I do with my discounts, what can I do with my treatment plans, what should I do with my treatment protocols. That's really all we had to answer to, because at that time there wasn't a lot of managed care and PPO agreements for us to get in. And then all of a sudden, I am in managed care agreements, and I have PPO agreements. And those are regulated by the Department of Insurance and overseen by the State Attorney General's Office. And the State Attorney General's Office now complies with federal anti-kickback and Stark Law regulations, because guess what? The federal rules and regulations, if a state follows the federal, if there's a claim and recoupment, the state gets a piece of it. So that's why you've seen all of the state attorney generals and their rules and regulations starting to model the federal rules and regulations. So now here we are, fast forward, anytime I make a decision about my financial policy or the discounts that I'm offering, or most everything else, even sometimes marketing that I'm doing, you need to start looking through the lens like this kaleidoscope and make sure that it's okay, not just with your board of examiners. I have a high degree of respect for my board, But the reality is, if my board says it's okay, that doesn't mean that it's okay in my provider agreement, that it may not be okay in the STAR clause or with the AG. It may not be okay at the federal level or at CMS, and more importantly, with the Office of Inspector General. And let me give you the reason that I say this. I was actually on a call with a Medicare carrier. I believe it was Noridian, been a couple of years ago. And I literally heard on that call the speaker for the insurance company or the carrier say, we don't care what you charge for your exams and x-rays or therapy. They aren't covered by Medicare. I don't care if you charge for them at all. And I thought, oh my gosh, I cannot believe that I just heard someone from Medicare and this carrier tell all these doctors that they don't care about what they charge for their exam, x-ray, and therapy. And then I had to step back for a minute, and guess what? They're right. CMS doesn't care. Guess why? Because it's not CMS's job to protect the financial integrity of the Medicare program. That's the job of the Inspector General. And it's the Inspector General that put out the bulletin, special alert bulletin, about gifts and inducements that says if you give away anything of value more than $10, total of $50 in a year, or, hear this part, you don't charge fair market value, meaning you bill STEM for $30 to Blue Cross and you charge a Medicare patient $5, you're helping the patient, but is that truly fair market value? And so here we are on this call, and it really becomes clear, wow, we have really got to start looking at these layers of regulations and understand that we must look through this lens to make sure that our policies pass muster, if you will, or are okay from the Board of Examiners to our managed care agreements, Department of Insurance, federal and anti-kickback, CMS, and OIG. And you're probably, if you're like me when I started thinking about this, it's enough to make your brain hurt. But the good news, doctors, is you don't have to figure out how to solve this problem. You do need to consider looking at a discount medical plan if you're offering discounts, and in developing your financial policy, when you plug this little vehicle into your financial policy, it makes all that craziness go away. We'll talk about that in a minute.
Excellent.
How about let's talk about it now? Here's the deal. I have probably read, I would say, almost every state's chiropractic licensure act. We scoured them for rules and regulations on advertising and discounting and what you can and can't do. And I'll give you a prime example. Florida says you can offer a time of discount, a time of service discount. So a doctor's out there offering a time of service discount. One gives 20%, one gives 50%. Which one's okay? Your board doesn't address that. You go to New York or to North Carolina. Their board says you can offer a time of service discount, and if I recall correctly, they say you can offer it up to 30%. Can you do 40? Well, their board said 30, kind of a gray area. So here's the deal. Even if your state says you can offer a discount, understand that the states don't always define the discount, and understand that your board is only speaking from the board perspective, and their opinions do not supersede your provider agreements. They don't supersede your Department of Insurance, your State Attorney General, CMS, or the OIG. So what I want you to take away from this is, if you want to be careful and make sure that your policies are following all the rules and regulations, that's where the Discount Medical Plan Organization comes in. And let me tell you why. Discount Medical Plan Organizations are not something that I created. They've been in existence for a long time. There are hundreds of them. As a matter of fact, most of them are owned by insurance companies. Go look up Blue Cross, Aetna, Cigna. They all have discount medical plans. They are all, in about 35 states, regulated by the Departments of Insurance. And it is perfectly legal to offer a discount to a member of a discount medical plan if you're part of a network. Doctors, that's how you give discounts to Blue. That's why Blue Cross, Aetna, and Cigna can all pay you a different fee, and it's okay for the exact same service. It's called a contractual network discount. That's the model that the DMPO operates under. They are regulated by the Departments of Insurance in about 35 states. I know that we've applied to operate under their licensure. What happens with the discount medical plan is it's no different than you joining a PPO. You join a PPO, they tell you what the fee schedule is. There's nothing, unusual or illegal about that. What is unique about the DMPO and the network that we operate is we don't dictate what your discounts are going to be. We do require you offer a 5% discount for professional services, but if you want to offer 20%, 25, 30, 35, 40, that's totally up to you. And now you have the protection of a legal network-based discount that will allow you to help your patients without putting yourself at risk. You can go ahead and advance unless you have questions, Marty.
Excellent. Yeah, I mean, prior to me meeting Dr. Foxworth and learning about Chiro Health USA, I was racking my brains for years trying to figure out how to be able to charge a cash patient less than an insurance patient in all these different, ways and, all these little hoops and hurdles. And then when I heard about Chiro Health USA, I went, finally, an answer. It makes it so easy. It's the answer to it. So it's really nice that, you offer this service and product.
Well, I appreciate that. It certainly helped a lot of our doctors, myself included in my practice, just be able to, I just want the craziness to go away. I want to help patients, and I won't have to be looking over my shoulder all the time. And the bottom line is that that contractual network discount works for the big boys, the Blues, Aetna, Cigna. It can work for us if we own the company and we get to write the contract the way we want in our favor instead of in the favor of the insurance company. And that is, you got the next slide up, the provider benefits. When I put this thing together, and docs, just so you know, I didn't wake up one day and just decide, hey, I want to start a discount medical plan. I had a problem in my office. My practice is on the campus of the spine center. I get paid well when I saw PI and workers' comp cases, but I struggle with what do I do with my cash and my Medicare for their non-covered services. I don't want to have a dual fee schedule. I don't want to have improper time of service discount. Well, part of my background was I did run a chiropractic network. We were actually the chiropractic network for the state health plan, 195,000 covered lives in that plan. And so that's kind of where I cut my teeth in learning about, how the insurance companies write their policies and write their contracts. I mean, we literally negotiated those contracts. I hired healthcare attorneys when we bid on that state contract, and we ended up with several other contracts. I mean, at one time we were the chiropractic network for about 7 different insurance companies in the state. And so, this just over time, I began to look at this like, why are they able to do this and we can't? And just like Marty said, it's almost like I had one of those aha moments and figured out that, wow, if we own the company, if I can write the contract, if I can hire the healthcare attorneys, follow the model that they use, then it makes sense. And that's exactly what we did some 5-6 years ago. One of the things that I wanted in this company, and the reason I wanted it is because I was part of another discount medical plan before, and they sold my contract. And all of a sudden my fees for PI and workers' comp went down the toilet. And I said, I don't want doctors to ever have a fear of us selling your contract. I don't want doctors to join my network and me tell them what they're going to charge. We can set a range or a minimum, but I want them to have the latitude to help their patients, whether they're in Alaska or whether they're in Florida, wherever they are. Patients are different. Fees are different. So some of the things that are unique about us is we do allow you to set your fee, your discounts with us within reason. You decide what works for your practice. There is no cost for you to join. The fee for the patient is $39 a year, and that covers the patient and their legal dependents for an entire year. And then in case I ever lose my mind and decided to sell this company, I completely devalued it to an outside company because you actually have a 30-day opt-out clause, which means my entire network could disappear in 30 days. I could never sell your contract. The whole thing could disappear. Some people have told me, boy, you're a great idea, Ray, you're smart, but you're a dummy for putting that one in. But that's what happened to me as a doctor myself in an agreement that I was in. And I said, I don't want that. I don't want anybody to have the fear of that. So we've really tried to put things in here that I wanted as an individual practitioner, And obviously, several others have too. We're over 2,600 doctors now.
It's working. It's terrific service.
This is probably one of my favorite things to talk about. And I want to make it real clear of what we're able to accomplish as a network. As a matter of fact, our tagline is the network that works for chiropractic. And that has kind of been my drive and my ambition since we started this. Every day that we are in business, for every card that is sold in the entire nation, there are donations made back to this profession. And I can tell you last year, to the Foundation for Chiropractic Progress alone, we were able to cut a check for $35,000. We were able to cut a check to the Congress of Chiropractic State Associations for $35,000. We donate $1.50 per card for every card sold back to the states that we have agreements with, and we have probably 25, 26 states that we actually have a formal relationship with, where they help tell doctors about compliant billing and coding and discounting policies, and we do that through webinars. And so I think all total last year we gave back over a little over $105,000, maybe $110,000, and we're probably close to $250,000 since we started this. And here's the good news. This didn't necessarily come out of my pocket. This didn't come out of a single doctor's pocket. These are patients joining this network and us just carving out a little more than 5% of our gross to give back to the profession. And for every doctor that joins this network, you're helping us be able to do more for those that are in the trenches at your state association, at the foundation, and at the Congress. And so, you know, I'm a staunch supporter of state associations, used to be president of ours. I know they're all looking for non-dues revenue. And so, you know, if it weren't good enough just to be able to clean up your financial policy, minimize your risk, and help your patients, you got to feel good knowing that, hey, everybody that gets in and that joins this, we're actually helping support chiropractic. That's a good day for everybody.
Excellent. You should be proud of what you're doing, Dr. Foxworth. I pride myself on trying to give back to the profession, and all the companies that I have affiliations with, I try to choose companies that are always giving back to the profession. So thank you on behalf of the profession for all that you do for us.
Well, I appreciate it. And again, the kudos goes to the doctors that are like the ones that are on the call today that make the decision to join this and be a part of it. So just to kind of recap what we've talked about, and we didn't go into a lot of the details, but you know, there are fines and penalties and rules and regulations, and doctors, as long as you're going to be in practice, you're going to be subject to them, period, the end. The smart doctors are going to not put their head in the sand. They're going to say, all right, let me know what the rules and regulations are. What can I, rather than us telling you what you can't do and shouldn't do, hopefully we've shown you what you can do and should do. We do not want you to risk your license or your livelihood. We want you to be able to practice with some peace of mind, and hopefully you've kind of seen the logical conclusion of all this is, hey, I really can get paid well if insurance is available, but now I have a PPO, if you want to think of it that way, for my cash and underinsured patients and for my Medicare patients for their exams, x-rays, and therapies. And I don't always have to be looking over my shoulder wondering if what I'm doing is okay.
Excellent. Next slide.
You know, this has been one of my favorite slides as well, is because I will tell you, just about anybody that's been to a chiropractic convention will come back, and you got to understand, we talk to hundreds of doctors a week, and they'll say, well, I heard this, I heard that, this consultant said this consultant said that, and it's enough to drive you crazy. And most consultants, when they're speaking, will tell you to talk to a healthcare attorney before offering discounts. And they do that. It's a CYA. They know that proper discounting can be complicated. The attorneys, the consultants, they know that there are regulations from that Board of Examiners all the way up to OIG. The consultants, the speakers, they know that state laws vary widely. I mean, none of them are the same. They also know, the consultants and the attorneys, they know that there are certain safe harbors. You can give a reasonable time of service discount in most states. Most of them also know that doing this stuff the wrong way is what exposes you to risk. And I will tell you that consulting the attorney is certainly a great advice. I have a number of attorneys that we use, healthcare attorneys and other corporate attorneys and our DMPO attorney, and I'm attorney poor, as they say. But we try to make sure we're doing everything right. But here's the deal. The reason consultants will tell you to talk with those attorneys is because all of this is complicated. But here's what no attorney or no consultant can tell you. They cannot tell you that discount medical plans aren't legal and aren't regulated and recognized in over 35 states. They are actually, by statute, recognized and regulated, just like the insurance companies are. And as long as we're doing our due diligence and making sure that we're following the rules and regulations, and we do, and we have attorneys that review us on an ongoing basis. Every time a state law changes, we have to make modifications. We have compliance attorneys that work with our DMPO that we work with that tries to keep on top of all this stuff. There's not a single consultant or attorney that can tell you that network-based discounts aren't the industry standard. And you know that yourself. That's exactly how you have contracts with Blue Cross, Aetna, and Cigna, and that's exactly why they can all pay you differently. So my point to you is, while you may hear conflicting information, the reality is if you want to make a solid and a safe choice, one of the simplest and easiest way to offer a discount is to use that contractual network-based discount. Hear me on this. This is not the only way a doctor could ever offer a discount. We've just found it to be one of the safest, simplest, and easiest to implement. Bottom line is your patients like to save money. They're members of Sam's Club or Costco, and you know why? Because they know if they're a member, they get a discount. So this isn't something that might work. It absolutely does work, like we've said, for some over 160,000 patients at this point.
Now, here's some unexpected benefits from joining a discount medical plan. So many of us.
Marty, you still there?
What insurance might pay and what we think their cash patient might afford. So Harvard's really good.
Dr. Kotler?
Yes.
Anytime you do that, you're living whether you take
Seem to have lost you or advanced the slide, or I was hearing some playback.
I'm hearing some.
Turn down there's a possibility that last slide may have had a audio embedded.
Oh, okay. Hold on. How's that?
Yeah. That's
Okay.
my alter ego.
Got it.
Yeah, this is, you know, I say this is my favorite slide. I've probably said that about every one. What can I say? I wrote it, okay? Here's some other benefits, and I didn't even realize this when I put the network together, guys, just to be completely transparent here. But here are a couple of things that we've seen a lot of doctors find out. There are so many doctors that artificially lower their fees because they're trying to straddle the fence between what they think PI will pay and what a cash patient can afford. And if in some states PI pays $100 and you think your cash patient can afford $50, what do? You put your fee at $75. Well, what does that do for you? Every time you see a PI case, you just left revenue on the table. Using the discount medical plan, what I encourage you to do is work with Marty as a consultant, find out what the UCRs are in your area, not just what other chiropractors charge, get paid like every other doctor gets paid. Set your fee at UCR, because now you have a vehicle for the cash and the underinsured and the Medicare patient to get a discount, so nobody gets hurt. You have one set fee, everybody's charged the same. The only time you offer a discount is when it's part of the network agreement. Shopper calls. You know, when I'm doing this workshop live, I usually ask the CAs to raise their hand, and I pick somebody to do what I call the chiropractic two-step. And in my mind, that's that shopper call, and they ask, how much is the first visit? And the CA breaks out into, well, it all depends on what the doctor finds necessary. I'll be happy to schedule for your complimentary consultation. I mean, we know the drill, right? Try this one. Ms. Jones, it does depend on what the doctor finds necessary in your case, but it could also depend on what your insurance company requires. And you're quiet, and the patient will say, I have insurance, and you can have that conversation. Or if they say, oh, I don't have health insurance, then our scripting is not a problem, Ms. Jones. We see a lot of uninsured patients these days. That's why we're part of Cairo Health. That's a network you can join in our office today for $39. And by the way, that covers you and your family. And the most your visit today is $150. You prefer morning or afternoon? Doctors, staff listening to this, we have for so long in this profession danced around that question, and it can't feel good to the staff having to answer that phone. We need to be upfront about what our fees are, what we charge, not be embarrassed by, and the reason that we've not been able to answer that question historically is we've had our PI fee, our workers' comp fee, our cash fee, our insurance fee, our mother, father, sister, brother fee, to quote Larry Markson. And when you join a DMPO or you plug this in, you can actually answer that question, because in our plan you can have a capped fee for a new patient or a capped fee for a routine office visit. Makes it very simple. Talk about the transition of insurance to private pay. If you're seeing patients in your office right now, and let's say they're a Blue Cross patient with 15 visits, and you recommend 30 visits, what happens on visit 16? You go back and charge your actual fee, or are you keeping it at the lower Blue Cross fee? Doctors, they have no insurance at that point. They're, in fact, a cash patient in your office unless that provider agreement mandates that you honor that fee. There's a few of those out there. But I want you to think in terms of what the patient is thinking. I have 15 visits. Insurance goes away. What happens to the patient? I'm going away. And that happens far too often in our office. But think about this scripting if you had the DMPO in place. Your staff goes over this. Ms. Jones, the doctor's recommended 30 treatments. The good news is you have insurance that will cover 15 of those, and you have a $45 copay. On your 16th visit, our actual fees will apply since you no longer have insurance. And it won't be the $65 that Blue Cross allows. Our actual fee is $95, unless you have one of those discount medical cards. Do you have one of those? The patient's going to respond typically, no, I don't. Not a problem. That's why we're part of Cairo Health. That's a network you can join on that 16th visit. And instead of your visit being $85, it'll be $55 or $45 or whatever your clinic chooses. And doctors, what patients care about is what they, and I'll borrow Kathy Mills-Chang term, what they care about is what they have to reach into hip pocket national bank for. And when they're seeing you and they have insurance and it's $45, and then insurance goes away and you've recommended 30 visits and it's $45, you will see a lot more patients continue with treatment because they can afford the $45. They've got that in their budget. They've built that into their budget, and they'll continue with treatment. We see it all the time in our practices. We have tons of doctors that will tell us, can't believe how many patients are actually transitioning to private pay once insurance is run out instead of running out the door. That's probably been the biggest eye-opener for me in practice, as well as the doctors in the network. The next thing, in some states there are still some closed panels or closed networks, and the patients that call and say, well, I want to come in to see the doctor, but are they in the XYZ network? And usually if you're out of network, you're out of luck. Our conversation when that occurs is, Ms. Jones, Dr. Foxworth isn't in that network, but do you mind me asking, what is your copayment for that plan? And if the patient opens up and says, well, I have a $50 copayment, so I understand that, and I'd certainly understand you wanting to use your insurance. However, a number of patients that have that plan find that their care can be just as affordable, if not more, at our office because we're part of a network called Cairo Health. That's a network you can join for $39 for you and your family for the year. And no matter how much no matter what's done on the first visit, it's $125 and then $45 a visit. Would you like to schedule to see the doctor? That's a lot better than being completely out of luck, I think. The next two things, I'll hit those quickly. We are probably one of the safest and simplest ways to actually have a fee for the mother, father, the children. You actually can have a subsequent fee for a second, third, and fourth family member. We actually have a legal plan that was put together by one of our attorneys who is a former health care regulator for the state of Maine. Very, very good document where the patient basically says, I'm in the network, you're in the network, I'm choosing to opt out of the network. It is a legal document that they sign. And, that's the next one on opting out of the high copays. But the form that the patient signs as a member of the health plan, as a member of the DMPO, will let you deal with those family members and keep care affordable and you can stipulate whether they come in the same day or in the same week. We give you some flexibility there. Now let me roll into that high deductible issue I was just talking about, because we are seeing more of those all around. I get patients with $5,000 and $10,000 deductibles today, and I may be in the health plan. And so my conversation with them is, Ms. Jones, you know, you've got a $10,000 deductible. The likelihood of us meeting that is probably slim and none. Patients in your situation often find that it may be more financially feasible if they're using a discount medical plan. Do you have one of those cards? So you can kind of see the scripting is kind of the same regardless of the situation. There's not a ton of scripts to learn, but you're basically opening the door, letting the patient know what their payment options are, and then you must let them choose. You can't force, you can't coerce, but you can certainly let the patient know what their financial options are. And that's what we encourage you to do. And all of those little scripts and all of that training is covered in our provider and staff training that we do. And Marty, I'm sure I know you've promoted our webinars before. We do this, I think, every Tuesday at 12:15 Central Time. If that's not a good time for doctors, they can sign up for it and they'll get a copy of the recording. But have your staff and the doctors, I encourage you to listen to that full webinar about why the discount medical plan model works. And then we actually have a separate webinar that will help you train your staff on how do you talk to a patient who's Medicare, Medicaid, in-network, out-of-network, high deductible. All of that's scripted. All of it's in writing. We send it to you in Word documents where you can tweak it and make it sound like you and your staff, and really try to do our best to make this a turnkey system for you.
I find it to be a very easy sale, and my clients find it to be pretty easy because it's, hey, Mr. Jones, our normal fee is $150. If you become a member of Chiro Health USA, it's $45. What would you like to do? It's hard to say, I'd rather pay more.
Yeah, only the ones that have had the frontal lobotomy tend to make that former choice.
I mean, it just happened to me, well, not about a year and a half ago. I was at my dentist, and I've been paying, I think it's $135 for a cleaning. So the receptionist says to me, why don't you join, I think it was Delta Dental or something, I forgot the name. She says, why don't you join Delta Dental? I said, okay, tell me about that, Well, if you join Delta Dental, it's only $65 for a cleaning. I joined right there on the spot. I mean, to me, it's a very easy sale. Oh, okay. So that's, so we're going to start wrapping it up. Dr. Foxworth, do you want to give everyone your contact information? Should they get in touch with you, Christy, 800 number, website, email?
Absolutely. Yeah, absolutely. Easiest way to reach us is on our website, www.chirohealthusa.com. You can send an email to the info@chirohealthusa.com. Our number is 888-719-9990. That's 888-719-9990. But seriously, feel free to reach out to us. Either way, all of those, I actually get every one of those info at email or info@chirohealth come directly to me and to my staff. They're copied to them, and we do our best to respond to you very, very quickly if you should have an interest in joining the network. And let me close with this. There are other discount medical plans out there, and doctors, if this one is not a good fit for you, please take a look at the others. Doing something just simply isn't an option in my opinion.
Yeah, I don't recommend they look at others, but that's nice of you to say that, right?
That's your call.
Okay, so now let me tell everyone a little bit, just a reminder, those of you that are not familiar with our Smart Choice program, this is a target coding program. It's not a membership. It'll help you SWAN. For those of you that do not know what that means, that's an acronym for Sleep Well at Night. So this is an analysis of your practice. We focus on medical necessity, cash plans, coding and billing, documentation. We do a forms review. It's a scrubbing. It's an analysis. It's an exam, and we give you a report of findings. It takes about 3 to 4 weeks to go through this, so I just wanted to let everyone know about this program. We also offer memberships if you're looking for more of an ongoing relationship with us. We have memberships. They range from $99 a month all the way up to $4.99 a month. So please let us know if you're interested. All you need to do is go to targetcoding.com and click on the services page, and you'll see all of our programs there. Also, we have a whole bunch of seminars coming up. crazy schedule of seminars coming up on ICD-10. We're going to be in multiple locations from now through July. Again, if you're interested in attending one of our ICD-10 seminars, just go to targetcoding.com, click on the seminars page. You'll see we're going to be all over the place. Most of them offer 6 CE credits, so let us know if you're interested in that. And just a couple other closing comments. You have to check with all the carriers. This is what Dr. Fox was referring to earlier, because my lawyer makes me do this, and this is so complicated I have to read this disclosure. You have to check with all the carriers you bill prior to submitting claims based on the information provided in this presentation to ensure that it is compliant. Cairo Health USA and Target Coding does not guarantee that the information provided in this presentation will guarantee payment from any insurance carrier or patient. Target Coding and Cairo Health USA is not responsible for any insurance carrier or managed care organization laws, rules, guidelines that may change following this presentation. Please understand, these things change all the time. It's important to do your best to stay on top of these changes that occur by attending seminars, webinars like this, and joining your national and state professional associations. Dr. Foxworth, any closing comments?
And all the people said amen.
Again, you want to contact Cairo Health USA, CairoHealthUSA.com. Email info@CairoHealthUSA.com. Telephone number 888-719-9990. Dr. Foxworth, thank you for spending some time with us here today.
Great. I appreciate the opportunity. Hope the information was helpful.
I really appreciate you. I appreciate Christy for all the work that she does for you, and I appreciate all the time and effort and money that you give back to the profession. So again, I want to thank everybody for attending this presentation. I hope you learned a lot. Take care, everyone. Bye-bye.